Hi, last class we discussed regarding milia. Milia is nothing but small pinpoint white or yellow spots due to increased fat secretion. Commonly we can see on nose, forehead, cheeks, chin of the newborns. You can see milia. Next we will go to Mongolian spot. Mongolian spot is nothing but it's a black coloration on the lower back, buttocks, anterior trunk and around the wrist or ankle of the newborn. It is not bruise marks and it's not a mental retardation marks. It's a Mongolian spot. It's bluish or blackish color. We can see on the back of the baby, buttocks, anterior trunk, on the chest wall. Like anterior trunk means chest wall and around the wrist and ankle. But it's not a bruise marks or it's not a sign of any mental retardation. So these Mongolian spots will disappear during preschool years without any treatment. Like preschool years, like 3 years, within 3 years it will disappear without any treatment. You can see Mongolian spots. See, it a black marks we are seeing on the shoulders, back, on the buttocks. It's not any sign of mental retardation or it's not any sign of bruise or bleeding. Next, erythema toxicum neonatum. Erythema toxicum neonatum, it's nothing but papular pustule surrounded by area of erythema. It's a asymptomatic disorder. It's not having any symptoms and it's no unknown causes also unknowns. It occurs in 50% of infants. Like erythema is nothing but it's a red color papules or pustule surrounded pimple. Okay, and it presents 24 to 48 hours of life and it start to fade within 5 to 7 days, and there may be chances of reoccurrence if we are not taking proper hygiene. You can see this erythema toxicum. Next, if you are coming to the in systemic examination, if you are up to now we saw general appearance, now we are coming to the head. Head of the newborns appear disproportionate to the large because head of the newborns is not proportionate, it's disproportionate because I already told, comparing to the chest circumference, head circumference is higher. So if you are coming to the 1/4 of total length, head is disproportionate to that length. Next, if you are coming to the frontanels, if anterior frontanelle will be felt soft spot and posterior frontanelle is so small and you cannot palpate that, but anterior frontanelle you can palpate, it is soft spot. If you are touching anterior part of the head you can feel soft spot, that is anterior frontanelle. You can see here, see these and all sutures, frontal sutures, coronal sutures, lambdoid sutures, sagittal sutures, that and all completely you studied in anatomy, and even in OBG you will study these sutures. So if you are coming to the frontanelle, you can see anterior frontanelle upon the head of the baby. If you are touch, you can feel soft spot, that is anterior. And if you are coming to the back of the baby head, you can feel posterior frontanelle. If you're coming to the sutures, if suture line should never appear widely separated. You can see the suture line I saw shown in this picture. Here you can see the suture line, frontal sutures, coronal sutures, sagittal, and lambdoid sutures. It's not, you can see it's not separated widely. Okay, so suture line should never appear widely separated in newborns. If widely separated, it mainly due to intracranial increased intracranial pressure, maybe due to abnormal accumulation of cerebrospinal fluid, or due to hydrocephalus or abnormal brain formation, or maybe due to blood accumulation during birth injury. If you are coming to the fused suture line also abnormal. This fused suture line we can confirm with X-ray or further evaluation. I will show the picture. You can see in this picture. You see in the first picture normal it is. See, metopic suture, coronal suture, Lambert suture, everything you can see. But if you are coming to the first picture, you can see there is one line missing. And if you are coming to second picture, this Lambert suture is missing. And if you are coming to the third picture, sagittal suture is missing. This one will call diffused or fused sutures. Okay, fused sutures. It is also abnormal. And wide sutures, if comparing to normal distance, it's wide extra. That one will call wide sutures. So widely separated sutures and fused suture lines, this also abnormal condition. It will happen mainly due to increased intracranial pressure or abnormal brain formation or abnormal accumulation of CSF fluid, and hydrocephalus or accumulation of blood due to birth injury. This word you remember, accumulation of blood due to birth injury. What is this? Caput succedaneum. Caput succedaneum is nothing but swelling or edema of the presenting portion of scalp. It's due to accumulation of blood clot or hemorrhage. That one we will call caput succedaneum. You can see the layers. Baby's scalp portion will be swollen, or it's presence of edema. It's mainly due to collection of blood clots due to hemorrhage. You can see here the extradural hemorrhage, cephalohematoma. This one we will call caput succedaneum. Next one, cephalohematoma. Cephalohematoma is nothing but bleeding between skull and periosteum of the newborn baby. So this cephalohematoma may be disappear by the weeks or month. You can see some swelling on the scalp of the baby. Next, eyes. If you are coming to the newborn eyes, usually the newborn eyes are little tearless because the lacrimal ducts are not fully matured. Until 3 months, the newborn eyes usually tearless and eyes appear clear without any redness and purulent discharge. And also we have to observe for the any subconjunctival hemorrhage or ophthalmic neonatum. Ophthalmic neonatum is nothing but infection of the eye. So usually newborns eyes are tearless because of absence of lacrimal, means not absence, lacrimal ducts are not fully matured until 3 months of age. So the eyes of the newborns are clear without any redness and purulent discharge. And you also observe for subconjunctival hemorrhage or ophthalmic neonatum infection. Next, ears. If you are coming to the ears, the level of the top part of the external ear should be on the line drawn from the inner canthus of outer canthus of the eye. You can see here picture. If you are drawing one line from inner canthus to outer canthus above the ear, above the back of the head, the ear line should be above that line, that is normal ear. But in abnormal ear, in abnormal angled ear, it's below that line. And low set ear, in low set ear, it's lower than that line. You can see 3 pictures. Normal ear, if you are draw one line from inner canthus of eye, from inner canthus of eye to outer canthus of eye. Inner canthus is, if you are drawing here, the first point near to the nose, that is inner canthus, and the outer canthus is near to ear, that is outer canthus. So if you draw one line from inner canthus to outer canthus towards back side, the ear should be present above that line, that is normal ear. And if that abnormal angled ear, the ear only touching the line, that is abnormal angled ear. But low setted ear, the ear is not touching that line, it's lower than that line, that is low setted ear. And you have to check for the cartilage form. And this cartilage is not fully formed in the ear, so the baby ear having instant recalling feature. Next, mouth. If you are coming to the mouth, you should have to observe mouth for cleft lip and cleft palate or tongue tie. You can see that cleft lip. And sometimes in newborns, 1 or 2 natal teeth also will be erupted. And if you are coming to the neck of the neck of the newborn is short and it is chubby and creased and skin fold. Head should rotate freely on it. So head is not sitting for the newborns properly. If you are coming to the chest diameter is smaller than the head. In females, there may be a pseudo milk production will be there, or thin watery fluid is squeezed out from the breast. That one we will call witch milks. It's pseudo milks, means it's not true. Some thin watery fluid secrete from the breast. That one we will call witch milk. Next, abdomen. Abdomen, we have to check for the bowel sound within 1 hour after the birth. And we have to palpate the edge of the liver and edge of the spleen for any disease condition. Next, umbilical cord. If we are cutting umbilical cord, it should have 2 arteries and 1 vein. You can see in that picture 2 looks little red, so that is 2 arteries, and 1 looks little yellow, that is 1 vein. During birth, this umbilical cord will appear bluish white, but after clamping it become dry and appear dull yellow brown, and the umbilical cord itself shed after 6 to 10 days after clamping. And if you are coming to the back, the spine of the newborn typically appear flat in the lumbar and sacral region. So the base of the spine should be free from any pinpoint openings. You should have to observe for any dimpling, any sinus tract on the skin, or any pinpoint opening. That one you have to check, because if any dimpling or pinpoint sinus tract in the skin will suggest spina bifida, or any hair projection, or any bleeding appearance. Next, genital area. If you're coming to genital area, the anus of the newborn must be inspect. And if you're coming to the male genital area, the scrotum is pendulous, and the both testes should be present in the scrotum. You can see first picture. And sometimes males one or both undescended testicles will be there. That one you have to note down. See second picture. This is undescended testicles. Next, female genitalia. In female genitalia, the labia majora should be fully covered labia minora. You can see in that second picture. That is normal. And some newborns, there may be mucous vaginal secretion will be there, and sometimes blood ting will be there. That one we will call pseudo menstruation. First one is preterm female genitalia. Second one is term female genitalia. Next, extremities. You have to observe for syndactyly and polydactyly. Syndactyly means absence of fingers. Poly means presence of extra fingers. And also you have to check for crease of the palm. See, if you are in first picture, you can see normal palm creases, but in second picture the little finger curvature is not present and its lip looks different. So this will suggest Down syndrome. Next, sole. If you are coming to the sole, full term newborn have creases covering entire sole. You can see second picture. Creases means that line marks. But in premature infant, the sole creases may be only upper two-third or may be absent. Next, meconium. Meconium is nothing but first fecal material passed from the baby. It's sticky, odorless material or greenish black. First fecal material passed by the newborns will call meconium. So this meconium will be sticky, odorless, greenish black or brownish green. It passed usually within 8 to 24 hours after birth. And the first urine is diluted because immaturity of the kidney, lack of ability to concentrate urine. This is regarding general appearance. Next we will go system assessment in next class.